I'm Garry Hopkins. I'm the CEO at the IOOF in Barrie. We have a long-term care facility here, but included in our long-term care facility is a convalescent care unit from which we're filming this morning. It's a 20-bed convalescent care unit. It's been in existence at the IOOF since about 2012. It's a very popular program in this area, as you can see with all the activity that's going on. We're well known in the community. This program is a program that's funded entirely by the ministry. Residents who come here don't pay a co-payment, so it's funded by the ministry. As you can see, we have lots of physiotherapy here with full-time physiotherapies along with physiotherapy assistants. The program is funded on a temporary basis. It's not a permanent program in the sense that it gets renewed as needed every 5 years, although it's been renewed for us since 2012. And this program is, we have a license until 2025, and of course, we hope to renew it beyond that period as well. So I was saying it's a program that's funded by the ministry, and we're very excited about the program. It's a very successful program. I have to give kudos to my team that's here, the physiotherapist, Denise, who's our coordinator. They work hard to ensure that our residents are happy and getting the proper program when they come here. So we are quite happy about this program and very excited. In other parts of the building, we have residents in our long-term care facility. We do have physiotherapy for them as well, but this is a separate program. It's called the Convalescent Care Program, but it's specifically for those who get admitted into the program.
I'm Denise Smith. I'm the Convalescent Coordinator for the IOOF Convalescent Care Program. I've worked in the program for several years now. It's an awesome program. We take anybody from the age of 18 up to seniors. There are qualifications to get in the program, and it's all run through the LIN. I've worked in long-term care for 43 years, and this change in this program is wonderful. You get to see the residents get better and then return to their home atmosphere or their retirement home where they came from, instead of keeping them out of long-term care as long as we can. So we get a lot of just a lot of people that are deconditioned or have fractured bones, and we help them to get better. We're here to help them throughout their whole stay with their follow-ups, all their appointments with the orthopedic surgeons, anything they need from us during their stay. I coordinate all that, all the admissions, all the discharges, family conferences. We meet with the LIN routinely on Wednesdays for meetings and discuss all the patients and their achievements. So at the hospital, I believe they don't get the intense therapy that's here. So we do Monday to Friday, 2 times a day in the gym. So in the morning, it's one-on-one. As you've seen earlier, the PT and the PTA is working with the residents. In the afternoon, it's a group session using different tools, so like ankle weights, TheraBands, and they do different exercises that way. So in the hospital, they would be getting maybe 10 minutes a day, perhaps, just working on maybe transferring and that sort of thing. So this is 5 days a week, twice a day. We get a lot of positive feedback. We do give them a survey at the end of their time, and I really haven't got a bad survey at all. I'm just so grateful for the program, that there is something out here for them to do, and not just stay in the hospital and have to go home and figure it out on their own. We just had a lady that came in and very deconditioned. She hadn't walked in 10 years. She wasn't able to, having a lot of difficulty with that. I hadn't driven her car, and she walked out of here with a walker. And actually drove to the cottage the next weekend when she left. So we still keep in touch with her, and she was so grateful, so grateful. It's just amazing.
We get residents from different sources. Some of them come from the LIN, the home and community. Some come from doctor's office, from RBH, just coming from the community. So if somebody's interested in this program, please get in touch with us. Again, the same number, 705-728-2389, and they can connect you to the coordinator here if you're interested in coming in here as a resident. If there are people who like to volunteer, we do have a volunteer coordinator here, and that person, so if you contact the main office here, 705-728-2389, and those folks can point you to who you can be in touch with if you want to volunteer here. And we're certainly seeking volunteers. COVID impacted our volunteers significantly, negatively, but now we're rebuilding the program, so if there are people who'd like to volunteer, that would be much appreciated as well.